Assalamu alaikum. So this is a case of a bladder tumor transition cell carcinoma, which was diagnosed to have a high-grade TA lesion. This is the right orifice. This is the left orifice, and this white is the area of previous resection. And so we are performing a Check Cystoscopy here. The aim of this recording and this procedure is to show the trainees, the residents, and the new fellows, the fresh fellows, how to do a Check Cystoscopy. We have to see the posterior wall completely. We have to be away from the mucosa. Here you can see that we are looking from up towards down, and then from down towards the upside, keeping in view the wide view of the right lateral wall. Now we are coming to the left lateral wall, as we saw something suspicious, so we came near. This is the resected area, the arrow pointing. You can see that we are going up and then coming down and then moving inside as well. So there is a lot of cystitis. You can see that this vessel is going, and this, I always follow these vessels because they are feeding some tumor or some inflammation. This is the resected area from the previous side. So there is no recurrence on the previously resected areas. However, following that vessel has led to diagnosis of this small papillary growth. This again is the resected area. So this shows that there were multiple small lesions on the anterior wall, the posterior wall, the right lateral wall, and the posterior lateral wall, the left lateral wall, on the dome as well. However, those areas are still clean and clear, and there are no growths or no recurrence. So we have seen all the walls, because if you are not seeing and looking for the tumor, it is highly likely that the tumor will be missed. Each and every corner of the bladder needs to be inspected. Majority of the times I have seen the beginners, they are too close to the mucosa, so they see very narrow and very small area. However, you need to be quite away. So here we have resected that mass, and now we are taking deeper tissue in the resection so as to get muscles as well. Here you can see. So this is the deep tissue. So I was talking about the newcomers and the beginners and the residents, that they usually do cystoscopy while they are very close to the mucosa, even rubbing the mucosa. So number one, they can miss any tumor somewhere in the vicinity, which is not visible if you are too close to the mucosa or the bladder wall. And second is that this may lead to injury of mucosa and lead to bleed, and bleeding again will hamper the vision, and hence one will not be able to see small growths. Recurrences are usually small papillary projections, and they need to be seen with the eye of an eagle. So this should be kept in mind, number one. And number two, the angle should be wide. You should not be close to the mucosa. The angle should be wide. One should see the posterior wall starting at the dome of the bladder, moving from left to right, and then from right to left, coming towards the bladder neck, and then go to the right lateral wall, from the dome to the bladder neck, up and down movements, and then the left lateral wall, and then the anterior wall, also pressing the anterior wall suprapubically with the hand, so that if there is any mass which is near to the bladder neck, becomes visible. So this is the way to perform Check Cystoscopy. If we have not done we had not done like this, we might have missed this tumor. So always a proper map of the bladder has to be followed. Thank you very much.